The puffy eye mystery, decoding your kidney's hidden signal. Okay, let's dive right into this. You know that feeling, right? You look in the mirror first thing in the morning and you're just instantly frustrated by that soft, puffy shelf of tissue hanging right under your eyes. Well, today, we're going to drop a bit of a bombshell in this explainer. Because those under eye bags, they're actually not a cosmetic flaw at all. No way. They are literally an upstream plumbing problem. So let's decode the signal that your body is, honestly, desperately trying to send you.
I mean, be honest with us here. How much money have you completely wasted on quick fixes? You've probably tried the cold spoon straight out of the freezer, the classic cucumber slices, or maybe dropping way too much cash on fancy eye creams with ingredients you can't even pronounce. You might have even tried cutting back on salt or sleeping propped up on an extra pillow. And yet, no matter what you do, that puffiness just stubbornly hangs on, making you look, 10 years older than you actually feel. It's incredibly frustrating. For decades now, cosmetic ads have been telling us that these bags are just bad genetics, or maybe a lack of sleep, or simply gravity pulling fluid down overnight. But you know what? Let's go ahead and debunk that gravity myth right now, especially for anyone over 60. Think about it. If it were truly just gravity, all that puffiness would totally clear up within an hour of standing up and walking around. But yours lingers, right? That specific pattern points to a totally different physiological reality. It's actually a direct signal from your kidneys and your sluggish lymphatic system.
To really make sense of this, we kind of need to talk about anatomy for a second. The skin right beneath your eyes is literally the thinnest skin on the entire surface of the human body. Unlike your cheeks or your forehead, which, sit over dense fat and tightly woven connective tissue, the tissue directly under your eyes is extraordinarily loose. It's basically like a sponge. It offers practically zero resistance to fluid pooling up. You can think of this area as your body's periorbital floodplain. When the river is running at a normal volume, that floodplain stays perfectly dry. But when something goes wrong upstream, like if drainage channels get blocked or narrowed, well, that floodplain fills up with water first, way before anyone upstream even realizes there's a crisis happening.
So what exactly is sitting upstream from your eyes? The answer is your kidneys. These two little fist-sized organs tucked into the middle of your back are actually the absolute primary drainage channel for your entire body. And man, they are working incredibly hard. Listen to this. Every single day, your kidneys filter roughly 180 liters of blood. 180 liters! That's not a guess. That is a documented physiological fact. They're literally processing your entire blood volume something like 30 times every 24 hours, regulating exactly how much fluid gets to stay in your bloodstream and what gets sent straight to the bladder.
Now, when doctors talk about how well those kidneys are actually doing their job, we use a specific measurement called GFR, which stands for glomerular filtration rate. Simply put, this just measures exactly how many milliliters of blood your kidneys are cleaning every single minute. Now, as we get older, this filtration rate doesn't just suddenly fall off a cliff one day. Actually, scratch that. It's more like it operates like sediment, slowly, quietly narrowing a drain pipe in your house. You don't feel any pain. There's absolutely no dramatic symptom that's going to send you rushing to the ER. You honestly have no clue what's happening behind the scenes until the sink finally starts backing up.
To put that into perspective, clinical research shows us that after age 40, our kidney filtration peak capacity drops by about 1% every single year. So by the time you hit 65, you might only be filtering at, say, 70 to 75% of your original baseline capacity. By 75, that can drop as low as 55 to 60%. And as this capacity naturally drops, your kidneys just become a bit less efficient at responding to this specific hormone called aldosterone. That's the hormone that controls your sodium and water balance. The end result? During the night, your body starts holding on to just a little bit more fluid than it really should. Now, it's not enough to cause dramatic swelling in your legs, but it absolutely is enough excess fluid to slowly find its way into that path of least resistance we talked about, your periorbital floodplain. But here's the thing. The kidneys are really only our first suspect. We actually have a second suspect operating at the exact same time, and that is your facial lymphatic system. Basically, you have this hidden conveyor belt of lymph vessels that originate near your eyes, and their whole job is to route cellular waste and fluid outward. But as we age, the walls of these vessels start to stiffen up. And if we aren't moving our faces and necks as much as we used to, well, that conveyor belt really slows down. On top of that, if you're dehydrated, that fluid gets thick. The difference between well-hydrated lymph and mildly dehydrated lymph is literally the difference between water and thin syrup. I mean, try pushing syrup through a tiny, narrow tube, and you'll immediately understand why all that fluid just ends up sitting right under your eyes.
Okay, we need to take a really crucial pit stop right here. Because we absolutely have to clearly differentiate between the harmless, age-related fluid retention we've been discussing and serious medical issues that require a doctor's immediate attention. So if your puffy eyes appeared super suddenly over just a few days, and maybe they're accompanied by foamy or dark tea-colored urine, that is a massive kidney red flag that requires a clinical evaluation right away. If the swelling is highly asymmetric, like one side is way worse than the other, and you have any history of thyroid issues or head and neck cancer, you definitely need to get your lymph nodes evaluated. And finally, if the puffiness shows up alongside rapid weight gain or shortness of breath, please go get a cardiac evaluation. But if none of those match your situation and your swelling is soft, symmetrical, and mostly just worse in the morning, well, let's keep going. To really see how this all plays out in the real world, let's look at Evelyn. She's a 63-year-old retired librarian. Now, Evelyn was incredibly meticulous about her health, but for nearly 4 years, she was just spending an absolute fortune trying to treat her under-eye bags with these super expensive clinical-grade serums and, fancy lymphatic massage devices. Her dermatologist told her it was just genetic. And her standard lab panels, they showed her kidney function was perfectly fine, sitting in that broadly normal range. But the actual truth was that her GFR had quietly slipped from the 90s down to the low 70s over the course of a decade. Evelyn was desperately trying to fix her floodplain cosmetically, all while that crucial upstream physiological signal was just being completely ignored.
Evelyn's story is a huge wake-up call because it kind of forces us to look at our own daily routines. We've established the natural physiological decline, sure, but we also have to investigate the accomplices in this whole detective arc. You really have to ask yourself, are your daily habits secretly sabotaging your body's ability to filter fluid at night? Because without even realizing it, you might be throwing some massive roadblocks right in front of your kidneys just a few hours before your head hits the pillow.
Now, what's really interesting about this next bit is seeing exactly how completely ordinary habits act as direct triggers. Let's take hidden sodium after 6 p.m., for example. And I'm not talking about going crazy with the salt shaker at dinner. I mean something as simple as a serving of cheddar cheese, which secretly has as much sodium as a whole bag of salted chips. Eating that triggers osmotic retention, meaning your body literally hoards water overnight just to dilute that hidden salt. Second trigger, evening alcohol. Even just one single glass of wine suppresses your antidiuretic hormone. Without that specific signal telling your kidneys to slow down, they just keep running at full speed, processing way too much volume that inevitably overflows right into your facial tissues. And finally, restricting your fluids during the day because you mistakenly think it's going to reduce your puffiness, that actually backfires. It dehydrates you and turns your facial lymph right back into that thick, immovable syrup we talked about.
All right, so here is the master plan, because once we actually understand what's sabotaging the system, we can finally stop just treating the mirror and start genuinely supporting the organs that are doing all the heavy lifting. We are moving from the problem right into the actionable solutions. So let's talk about 3 incredible filtration superfoods. These aren't just folk remedies. This is based on documented biochemistry. First up, parsley. Just 2 tablespoons a day gives you these amazing compounds like apiol, which actually acts as a super mild diuretic. It supports your kidney filtration, but completely avoids stripping out your essential potassium. It's fantastic. Second, cucumber. And I mean eating it, not just slapping slices on your face. Having half a cucumber a few times a week gives you a great hit of potassium to perfectly counterbalance any excess sodium. Plus, it has silica, which really supports your connective tissues. And third, dark berries, like blueberries or blackberries. Just half a cup daily provides anthocyanins. These are incredible because they literally strengthen the walls of your tiny capillaries, physically slowing down the rate at which fluid leaks into that delicate under-eye tissue.
Okay, before we get to the actual mechanical protocol to fix this, I really want you to establish your own personal baseline right here, right now. Are you ready for the periorbital press test? Here's what we're going to do. Take 2 fingers and firmly press them right into the skin directly under your left eye, kind of like you're gently pressing a soft peach at the grocery store to check if it's ripe. Hold that pressure for 5 full seconds and then release it. If your skin springs back almost immediately, great. Your fluid movement is actually fairly functional. But if you see this sort of doughy little indentation left behind that takes longer than 3 seconds to smooth itself back out, then you absolutely have meaningful fluid retention happening right there. Now, to actually drain that sitting fluid, you have to find the gate. I want you to slide your finger right along your jawbone, starting from your earlobe and moving forward. When you get about halfway between your earlobe and the actual point of your chin, you are going to feel a specific spot that's slightly softer than the bone. It might even be mildly tender if you press on it firmly. You found it? That right there is a primary lymph node cluster. It is literally the central drainage gate for your entire face. If you feel a sort of dull pressure when you press it, congratulations, your facial filtration gate is active, and more importantly, it is reachable.
So now that you've located the gate, here is the highly anticipated 90-second mechanical morning routine. And listen, this is key. You have to do this while you are still in bed, before you even stand up. We want to initiate that drainage before gravity even gets a chance to take over. Okay, step 1, simply place your fingers right at the inner corners of your eyes and apply some really gentle downward and outward pressure, sweeping toward your cheekbones for about 10 seconds. You're going to repeat that 3 times. Step 2, go find that jaw node we just located a second ago and apply a nice, firm, steady pressure to it for a full 60 seconds. Do not rub it, just hold it there. Step 3, make 3 slow, firm strokes all the way down your neck, heading toward your collarbone. This physically moves the pooled lymph right back into your bloodstream. That's the whole shebang. 90 seconds every single morning.
Now, to get the best results, you'll definitely want to pair that quick morning routine with a few easy daytime and evening habits. This is what keeps that lymphatic conveyor belt happily running all day long. During the daytime, try doing 20 slow jaw circles and 20 head turns, maybe every 2 hours or so. This mechanically squeezes those facial lymph vessels. Then, in the evening, try to stop chugging large amounts of fluids about 2 hours before bed. Just stick to small sips if you get really thirsty. Have a nice clean dinner, avoiding that hidden sodium like the cheese we talked about. Skip the alcohol, and here's a great trick. When you finally get into bed, try elevating your calves just slightly on a pillow. This naturally redistributes your leg fluid super gradually overnight, so it doesn't suddenly overwhelm your kidneys at 3 a.m.
Remember Evelyn, our retired librarian from earlier? Well, she took this to heart. She swapped out her late evening cheese and wine habit for some roasted vegetables, and she fully committed to that 90-second morning jaw node protocol, along with the daytime maintenance. And honestly, by addressing her upstream floodplain completely physiologically, instead of just cosmetically, her results were absolutely undeniable. After just 2 short weeks, she noticed her puffiness was completely subsiding way earlier in the day. Like, by noon, her floodplain was draining way faster than it was accumulating. And by 6 weeks, her morning mirror finally looked exactly the way she had spent years and countless dollars trying to achieve with those absolutely useless serums. It's a real game changer.
You see, the mirror really doesn't lie. It has just been totally misread for a really long time. So I want to leave you with this somewhat provocative thought. What are your kidneys quietly trying to tell you every single morning? I really want you to start paying attention and reading your body's signals. And hey, to help us build our next explainer so it's perfectly tailored to your exact physiology, drop your age and your location in the comments right down below. Seriously, a 62-year-old's filtration system looks very different from a 74-year-old's, and your input is literally what drives exactly what we investigate next. Thank you so much for joining us on this deep dive, and we'll see you in the next explainer.